Today, we dare for can discuss about health matters. And we want to deal with the precautionary measures them we take for left from the diaspora for go salon. We be don't plan this program even before the outbreak of the Lassa Fever. Although Ministry of Health and Sanitation tell we say make we not call them outbreak because not so beaucoup people them don't get infected. But today at the program, they count somebody we I think say we self done the area we can call and take part in the program. But he go introduce himself and he go tell we small but in medical background before we start the program proper. Yes, Aisatu, tell we small about yourself and your medical background.
Okay, well, good evening, everyone from the diaspora and around the world, whoever is listening to the radio. Mina Aisatu Kakejalo, Mina registered nurse as well as Mina family nurse practitioner. I done the work as a nurse for over 8 years. Now the acute care, where people they're very sick, we then admit in the hospital. And as a nurse practitioner, I don't work in primary care. We deal with prevention, for identify early screening, early detection, and management for hypertension, diabetes, or other health problems then. And then recently, for the last 1.5 years, I currently work in oncology and hematology. So oncology, they deal with cancer patients then. Hematology, they deal with people that we get like sickle cell, anemia, blood disorders then. So in total now about 13 years I've been at the nursing profession. So which means I have a master's degree in nursing. Also, we want to talk to the family. All today, I don't know how many of the people are there for travel this year, but it's very important. We take care of ourselves when they go, and we'll come back.
All right. So I want to make we start with the Lassa Fever. What thing you want for explain to we get some understanding within this Lassa Fever?
Okay, the last time, that was Saturday, where the topic come up. I've been calling because I've been feel the need to do a little bit of search for find out which are the epidemiology, meaning which are the cause of the disease, why the disease happened, and things like that. So, based on the definition, the Lassa fever now like a hemorrhagic illness, which, it's caused by the Lassa virus. But first, let's find out why they get this name. The reason why they get this name, back in 1969, they find out, people them end up with this disease in Nigeria. So during that time, they get about 300,000 cases, and then about 5,000 then being died, which from that moment. So this is not the current up-to-date, with the overview of really how the name come about. So they get a town in Nigeria, what they call Lassa, right? And that was initially in 1969. Then I've been also mentioned because people have been concerned, say, they not vaccine with them cows, with them give to them, but I think take a step back and say, this not animal born or zoonotic viral illness, where they get exposed through, contaminated food or household product. We don't become contact with rat, like the feces or the urine of a rat. So let's say you pan some side, and then this rat, we don't infected, it become contaminated, and then you probably forget, wash the pan or the item, and then you they become exposed that way. Now, one of the many ways, so mainly in a rat, like, a rat will get the virus, so that's how you get exposed to it.
Okay, so now time don't reach for make we go salon. We know say we don't get a plan for the one-on-one like what we for do and all that thing then day. So starting from this Lassa Fever, waiting at the precautionary measures then we get for take, or we even now we can able advise with people and we do overdo waiting them for beware of.
Okay, so yeah, before we even get into that, let's quickly think of waiting can happen where you get this disorder or this illness, like where you become exposed to it. So like the symptoms, it actually start around 7 to 21 days where you become exposed to it. So some of the things that we go for begin the experience now fever. They become tired. You hate they begin hurt you. Like your blood pressure. If you go low, your chest go hurt. Like you can get some stomach problem there. You will feel like you want vomit or you vomit. Diarrhea and things like that. And also bleeding. The reason why they call it hemorrhagic, the word hemorrhagic now bleeding. So you can bleed now your nose. You can bleed now your bum. Then nothing and nothing will happen. But also, all of them understand, say, this, get no vaccine. That's very important to protect yourself. They don't get vaccine for protect you. And the people that we can get infected with them, is like, or they can get for treat them with like an antiviral. The only medication and we then get available that we call ribavirin, or then also therefore treat you like supportive treatment. So if you get fever, then give you other things for bring the fever down. If you dehydrated, then they'll give you fluids for ensure that you not become hypotensive, meaning like your blood pressure not will drop, right? And because if they don't do that, the things that we get for affected, they begin to affect other organs then, like your kidneys, your liver, your spleen. And you need those organs, for like you really, your body function properly, right? So because if then things and they become complicated, your kidney can shut down, your liver, now one of the organs and we metabolize, meaning the process medication, we take medicine. So if that then get infected, then they really at a loss. Then we been also talk about where we say the Bella woman then, being the woman we actually then do surgery and we die, So really this fever, or virus, it cause spontaneous miscarriages, for people that are within like the first, second trimester. The people that are within the last trimester, meaning going from 7 months up to the 9th month of pregnancy, then they can die from this. And then will be also mentioned, say, about 15 to 20%, can die from that, like the people that we hospitalized. So if you get exposed, they admit you, people can die from this. So just also remember the symptoms now they kick in right away. It takes some time. So but the moment you begin to experience then symptoms that I don't mention, you definitely want to seek help, so that they will take care of you.
I think say you make it clear now, because this morning when they interview somebody from the Ministry of Health, it tell we say make people not panic, but if they report quick, then get either medication or I don't know if an injection or something where they go give to the person but not to vaccine.
Right. So the people that, like, if you get sick with the virus, they don't confirm and say you get sick with the virus. You forget the treatment, that ribavirin, then they give you in IV form, meaning drip. But if you not get sick, but like you feel like say you don't expose to somebody who didn't get the disease, so what you can do, then they give you the medication prophylactic to prevent the problem from happening to you. So that they can do for them currently. but then get for confirm. So within also I've been take a look at now within the World Health Organization identify as criteria for let you say this person get the disease, even though they get for send the lab out, but let them confirm this. So let's say somebody gets fever, like for more than 38 degrees Celsius. And then, it only go about less than 3 weeks. Remember, we say 7 to 21 days, so that's 3 weeks. But if fever now, if it happen within that time frame, now one criteria, that is like a big thing to consider. And also, then begin to complain, say, then they bleed, then begin to complain of, vomiting or diarrhea, then symptoms, then then get a list of symptoms, with the person they present with, where they help for identify the problem. But let's not forget, the problem is a mimic like malaria, right? It is the symptoms then can become similar with malaria. So then we'll give you anti-malaria medication, but they work. Because why? Not to the same thing for treatment. It's not a virus. Where malaria, we'll get to talk about in a short while, not a different problem.
I think you don't help we for make we understand the symptoms them way we for look for. So let me say now, let we talk to the people them now the north and the surrounding who say this thing happen. What are the precautionary measures them we ain't supposed to take?
Okay, so definitely hand washing is very important in everything we do. People then feel say very simple for washing hand, but not the most effective way for get rid of germs, right? So that is like one big step we will take. If say you sick, stay away from other people then. So let you not spread the disease, let this disease not go around. That is a very important thing. And also make sure you get like a thermometer. Especially if you go to Africa, I recommend like you get a first aid kit, a thermometer, meaning like the one you take for check your temperature. So you will know what's in your temperature. If you begin to get fever, even when you're not in the diaspora, but a day the problem begin with you. You get for seek medical help at that point, right? And then, make sure you drink water when, pure, like them bottled water. We all know about that. So those of us that's been going around, to Africa. Then, cough hygiene is very important. So I think we briefly mentioned that in one of the programs. We cough, definitely, so if you use sleeves or if you use tissues, and then also try to put that. If you see somebody around you, you get mask. Not feel like, say, a bad thing. Then they wear mask so that they not infect you, so they not spread the germ. So that's very important for you. So if you know get water for washing hand, if you use hand sanitizer. Without hand sanitizer, it's too bad. When you use them, if you don't use them for about 5 times, try for washing hand. Because when they use the same thing over and over, really it's not effective anymore.
So, okay, hand sanitizer and water. You say for they use the same thing over and over. But if you wash your hand over and over, it's good. So what to make for use hand sanitizer over and over more than 5 times no good?
Well, you actually they bring in more germs because the first one we don't get rid of. You kind of become sticky if you really, so you just add dirty, contact dirty in a sense, right? So, but immediately after you don't use them for 3 to 5 times, get soap and water. Now the best way for for really get rid of germs in your hand. If you touch, you go to a public place, you don't touch the mouth, you don't touch motor car, you don't touch certain things there. It's very important, let you know, say, before you put food in your mouth, before you touch anything with a food, let you wash your hand with soap and water. That can help.
Because now the other thing I ask, for wash the hands, now you can just wash them with water or you need soap for wash them?
You need soap and water and warm water also.
Okay, soap and warm water for wash the hand. So, but if warm water not there?
If warm water not there, but for burn yourself, right? But whatever, it better let you wash your than you not wash your. The reason is they not let you use cold water because, if you get any grease in your hand, right, cold water not going to take down off your hand. So that's one of the reasons too.
Okay, so I think we don't begin diving to the other topics then. Now we left Lassa Fever first for now. Let we go into the other topics then now for going to Sierra Leone. One-on-one. Yeah. Who side first we first start?
First, you get for try from the CDC website, because or you go see your health practitioner, the possible way they take care of you on a regular basis. You tell them, say, I travel, either then can check for you in the system for no say you go to this country. Let's say, they go to salon now, you go salon, they enter salon at the CDC Center for Disease Control and Prevention.gov. So you just need to type in cdc.gov, and then what they ask you, let you put in who say they go. If you get any health problem, let you select Dandy. If you get any picking the way they travel with you, you also enter Dandy. Why you do that? So it will guide you for tell you what you for do. So, when you do that, basically the Center for Disease Control want to make sure, say, if you go any side out of the country, Sierra Leone, for example, you want to make sure, say, you up to date with your routine vaccine then, right? So vaccine will include, your measles, your mumps and rubella, the varicella, that then are the chicken pox. Well, some of them, they don't get chicken pox with them have been picking. With them younger, so basically they already don't get exposed to the virus. So, and for measles, it's very important that you vaccine the beginning. So we see sometimes when you go for some job, then and they want to let you do blood draws just to make sure say you immune to that. You tetanus vaccine, those are important. Also, flu shot if you need it. Some people and they decline them. Also, the polio vaccine. These are all, routine vaccine that we for make sure so you up to date with that. When you don't get on the other thing that we have to worry about, hepatitis. Different types of hepatitis. Then get hepatitis A, B, C, and E, D and E, right? So, hepatitis A, you get down through contaminated food or water. So it's very important the water they drink. It's very important the food they eat. So getting those vaccines, it can prevent you from getting liver disease. So like I mentioned, the liver, organ where they process a lot of medication then. So if it become toxic, it cause complications then, right? So hepatitis B, same thing, a virus where you will get through, the liver virus. So with that, you can get on through body fluid exposure to, like somebody get the disease and then you become, exposed to their body fluid, whether it's blood, semen, and things like that. You can get hepatitis B.
Okay, make I ask on this one, where you say body fluid. What about sweat? The next person, if he gets it, then sweat up by you.
No. Okay. Sweat not the one thing where they exclude. So that's not in there. No. Okay. So then
we'll be there on B.
Okay, so we're on hepatitis B. So you really get hepatitis B through sexual contact, contaminated needles, and blood products, right? So the CDC recommend that you get vaccine. If you say you have to become exposed with somebody, your partner, if you're already immune and then not immune or then get the disease, your risk is lower, right? So if you get tattoo, then we will get put tattoo on their body, then anything with a needle, then hepatitis B and things like that, you can become exposed to it if the person already infected. And then hepatitis A, we mentioned that the contaminated food and water. So definitely then picking them back, then they forget this vaccine. Usually if they're born overseas, then doctors can make sure so they can get the vaccine between the ages of 6 months to 11 months or 12 months to 15 months. So those are for pediatric patients. And if you still say you get like a typhoid. So first, let me go to yellow fever. Yellow fever, the vaccine, not big deal in America. They're not available like that. So when you want yellow fever vaccine, you get to actually search for it. Either you or your provider in search for you for find out who say you go get them. Then not get them. Sometimes you get to go see an infectious disease doctor. We not then get the vaccine available for that and give you. So the vaccine good for 10 years. But after 10 years, you need to get the booster. But if you did travel, make sure you get your vaccine at least 10 days before you left the country. Because if you don't do that, the vaccine not valid. So then they give you the yellow card, we're not valid. So it's very important that you get the vaccine before you go.
Okay, so we don't deal with all the way about we're not come to malaria yet.
No. We will come. So you want to tackle malaria? Okay.
Yes.
So but before we even go to malaria, Lord tackle yellow fever. We also either get them through mosquito bites, right? The symptoms then for yellow fever can start 3 to 6 days. It begin with fever, chills, headache, back pain, muscle ache. So about 15% of people that will get yellow fever, they can develop serious illness, right? It can lead to bleeding and shock. When you bleed too much, you don't get enough blood in the system, you become, you faint, you pass out, your organ then they begin to fail, and eventually it cause, death, right? So now like a sister copy of the malaria. For the Peking there, the vaccine, definitely they recommend them for somebody with like 9 months of age, that not them forget the vaccine. But like if they really travel with your Peking, then younger than 6 months, and you'd for be caution. So around 6 months to 8 months, they can get them the vaccine. But we can't just want to make sure they check the Peking back, for make sure you're not sick out there. Because who can go with small Peking and then can come back very sick.
Somebody they ask, he say they can say them vaccine and they make people sick. He want to know if not true.
Well, I as a health practitioner, I really feel say vaccine it will be more prevention than cause you harm. For example, I just take the flu vaccine. Why they take the flu vaccine? Sometimes people when they get the flu vaccine, but then still they get the flu. Then they get the flu, but they're not there for be sick, like the person will not get the vaccine. Then sickness, will become, more severe. It will be a less form of the illness than the one way they say, not even touch the vaccine. So I really recommend vaccination. Now prevention. These are like primary preventions. Because if you want to do secondary prevention, that's a different thing. And if you want to do tertiary, that's a different thing too. So doing the primary prevention is more helpful than doing, secondary. Secondary, you already go say, okay, the problem did it. Last 4 times, very early, and then last 3 times, so let it not become worse. Tertiary, you don't already get them. It don't become worse, right? So immunization, I really don't think that's the way to go because we all live in New York here. Recently, there was an outbreak of the measles, where EBC, is one of the vaccines that we for actually get. This now virus where you can get through the air, so not like a respiratory droplet. You can get them through where somebody cough, you can get this virus, then cough or then sneeze, you come in contact with their saliva, then you can get the measles. And then the time where you begin to see the rash now, like 3 to 5 days, the patients go or the Peking go begin to complain of runny nose, feeling sneezy. Then them become red and they cough, and they can get like some spot then inside their mouth, which now like purplish blue color, and they complain of like sore throat and the neck like bumps them, right? So saying that the vaccine makes the skin sick, you see already waiting in the pause. Look the symptoms and way it present with when you not get the vaccine. So definitely taking the vaccine and the key, because when you get the problem, then just therefore treat you like supportive care. And they only treat whatever symptoms you get. They're not getting any medication for you for that.
Somebody so asked. Okay, you don't do that side, eh?
No, all I want to say, picking them from 12 months to 15 months for getting vaccine. Also, then forget another set of it from 4 months to 6 months. That's the second dose. And then and it has to be 28 days apart. But that is something with the health practitioner will explain to you how they forget that,
Somebody they asked, say, what is the difference between virus and disease?
Virus and disease. Virus now something we can infect itself, right? Like, so somebody say you get upper respiratory, like you get cold. So sometimes we really can encourage people for let them try for get rest, drink enough fluid, drink tea, and take like ibuprofen, like Tylenol or, Motrin. Because why? You don't want to give somebody we get virus antibiotics. We give them antibiotics, they cause a resistance. Like, let's say now, Daniel, it don't give you, okay, it make you feel better, right? But really, you didn't have a bacteria to treat. Your body needs some immune function for let it fight certain infection. Then certain infection in your body is normal for let you get that. But now, then you end up with a disease when like a bacteria. Then they won't treat you. They don't treat you with a specific antibiotics, but it not work. Why it not work? Because you be don't exposed to them maybe multiple times. Now your body don't become resistant to the antibiotics. So most of the time we'll do a blood test, or we'll do cultures. So it is done at the lab for know which antibiotics can treat this. It give you a report that talks about these antibiotics. You can treat them with this bacteria. This, they will treat them with this because it's resistant to it. Or not intermediate. It will do a little bit of good, but you still need to change the antibiotics. So now the difference and one bacteria, when like germs, virus, it can fight its cause. So we tend not to give antibiotics during that time. We want to do supportive care first.
Okay. Somebody they ask, is say, if you don't take Hepatitis A vaccine from your workplace, and also the second one due next month. You say you want to know if you like when they go salon soon, if you forgo with the reports where they go salon.
I think it's very important that you get in vaccine record, right? So where you go, so they're not going to duplicate anything for you. God forbid you go, you feel sick. They begin to do tests. They begin to tell you, now this wrong with you, now this wrong with you. But you get your records, say, I've been get this, I've been take this vaccine, so this is not my report, right? So I think it's important for you get that real time.
Okay, talking about going with records and whatever, is there any kit? Is there something that you go advise, say, like when we're going to Sierra Leone, we need forget this inside we bag so that even though it not go prevent, but it will be better having it.
Yeah, like, the mosquito spray, we then call the Repellent spray. So if you get ingredients, we now like DEET, that's not like really a chemical name, but most of them, like the one way, it say mosquito repel, it say OFF. So then you get you just spray and by your skin. Where you go sleep, it help. And also if you get outdoors and you go for going to them bushy areas, then try for wear long sleeves or long pants, and also wear hats and boots. So let go mosquito go bite you, and then when mosquito bite you, begin to scratch them. When you scratch them, it will become infected, right? And then you don't know that mosquito will bite you if you get infection like what will cause malaria. So you don't know about that.
So
So
now,
it's very important to do that. And also the bed net. If you feel like, say, you're not possibly comfortable for sleep under the bed net, make sure, say, you implement that. And the other thing is, if you get air condition, say you go, you make sure that it on, because that all can help for drive the mosquito away.
so now we talk about waiting for COVID. Let me come to malaria.
Mm-hmm.
How prepared we for be for malaria?
So before you go, you want to make sure, say, when you go see a doctor, you tell them, say, they go Freetown or they go Sierra Leone. Just say Sierra Leone. Then we'll make sure, say, then give you anti-malaria medication, then we for take. So you begin for take 2 weeks before you left. So based on your age and, because in picking the road and therefore calculate the dose and everything, but you get for at least take 2 weeks before. So now once a week, so you take week 1, week 2. So if you don't see they go for 4 weeks, then they give you additional 4 tablets. And then we come back, they take another one. It take for additional 2 more weeks.
All right. Let us see. I don't know. We don't touch about the typhoid because now that thing and
yeah, we don't talk about the typhoid. So just to go into malaria itself. So as we already know, it is spread through a mosquito bite. The symptoms then can actually begin from 7 to 30 days, but it can take up to 1 year. So that is key. So just because you don't come back 1 month, 2 months, everything looks okay. But then you begin get sick, like you begin to get fever, very high fever, like your temperature now 104 point something or 102, and then you begin to feel shaky, you feel like, say, you nose they run, your body they hot, you tired, and you sweat. Right, you get sore throat. Your throat they begin to hurt you. Your appetite not that good. So then, you forgo to the doctor in place and tell them, say, I've been traveling this time. I've been traveling, but I don't come back. But I don't. I've been okay, but I don't begin to feel like this. Let them run tests. Let them know, say, you can go. It's very important. Not be shy, but tell them, say, you can go to salon. There's nothing wrong with that, because the earlier they caught putting the gun with you, the better it is. So because when mosquito bite you, like you don't put open, so now they go attack your liver, then you attack your red blood cells. So it begin to multiply. When multiply, when open, then at the 10th day you begin to experience then symptoms. Yeah.
Okay. Since we didn't have this malaria side, somebody asked the question. He say, he come back from Salon couple of months ago. He say end of August to be precise. He say when he come back, he began for checking himself nearby ER. He said to him surprise, then put him on isolation and for a couple of days until he gets better. He say anybody when they come inside the room, get for wear a mask. He say feel so embarrassed. He say why then go treat her like say na Ebola I get. He want to respond. Well, our answer, Moses, the same thing happened with me. And I think that's why we're having this discussion right now on the radio. Because the same thing happened with me, the same thing we then do with you, now the same thing then do with me. I was on isolation and till I get better, and then me tell me say I'm not immune again because me not be they take any treatment while they go salon. I was like, no, me not bobo pain. I'm all well and good until I don't know who I go contact her, who I not contact them, but when I came back, me self be there for 1 week. So, but now, what's in now the fear, because in Sierra Leone, malaria is just one of those things. That's alone. But it's, now malaria gets on malaria.
Well, now a very deadly disease. Malaria, it will affect your red blood cell and your liver. It can end up lead to organ damage. Your kidney can shut down, and then sometimes the malaria, where once you don't affect the liver, it becomes toxic, and then it travel in your brain. Now the third and they really people then they become confused, and then they get seizures. So now the malaria don't become a malaria, we affect the brain, right? So in as much as we feel say we now from Africa we come out, we don't get a mosquito then the bet we, but sometimes if you hear people like even say, why the mosquito not the bet una within our salon? Why now we will cut the bet? Because the mosquito then they feed off your blood. And they feed off your blood. But I'm not saying the people that will come over vaccine, I didn't get the best one and one of that. That's not the point. The point is you know that your immune system really is different from the ones that within a salon at that moment. Probably, then they take all the precautions that were necessary. You go on a vacation, you need to pay attention to them things there. Like say, we didn't have so you sleep comfortably, you don't need to worry about dirty, the place dirty, all landed, sanitation a problem. Then they make, water they sit all together, the mosquitoes they build up and things like that. And just to go back to the the person we asked about the mask and everything, just know say when people then wear the mask, then wear gown, then wear gloves, then therefore make sure you will come, you knock out sickness. Because if one person is sick, we will control the sickness. Make a lot of people then become exposed to it. I think we will eliminate the problem. But if we get one person sick, then, we'll not take all the necessary precautions then now it will spread. It will begin to spread. Just like how we would not know how to handle the Ebola initially, which end up for happen. A lot of people then get sick. A lot of people then get, they lose their life through that. But we then educate them on how to take care of them. We then take care of them, and after all, them being all okay. Right? So now a precaution. I don't think, we should find that offended. Yeah, you go be very distressed, to tell you the truth. We can't then go put you in isolation if you're in a room by yourself. Anybody with this kind of wear mask, because they're not going to go take care of other patients there. They don't want to spread the disease. So some of them disease then also, like we'd already say, they get on through contact, bodily fluids, or it gets on through a respiratory route, like even, for example, somebody will probably get tuberculosis, like if they cough, not the air, so you kind of inhale that, you end up exposed to the bacteria, because the tuberculosis is not bacteria. Right. So sometimes too, they look for healthcare jobs. Then one day you do a PPD. Then they call down the PPD, which is now like a skin test. Then they do you go back like 48, to 72 hours, and they read out. If you become positive, then get for sending for let you do chest X-ray. Then they send you for let you do chest X-ray. Why? For make sure say this illness is not in your lungs. Right. And then they will clear you. So from that moment, they get to give you medication called INH. So they take that for about 6 to 9 months, but recently they can encourage them to take up to 12 months. Why? They don't say you don't expose to the bacteria, but they don't know how or when or where. But in order for you, go get that respiratory disease then they give you treatment for it, like not prevention. Like we always say, prevention is better than cure.
Okay, I think we're not going to do everything today, but George make a point on this malaria where I think when we be small, we be able say the Europeans them, where them be go salon, na malaria mosquito bite, na in the rebe then come out. So maybe because of that, then they fear more than we done the salon of African descent, because like I said, the first student, I was like, no. And they say, no, you're not immune anymore. So I don't know if the genes or where they inside me, where they fed the malaria back or whatever. I don't know what in the was and come but I think I need for go was na that water we go bring and come back. But on a more serious note, I just want to touch on food and drink before we go begin accept calls and go let you for go. Food and drink, what's in the advice?
Definitely, we don't talk about the bottled water, which is very important that you try to make sure you eat safe food that are safe for you. You don't want to eat any food we know cook. all the way, so food that are cooked and they then serve them warm. So you go just now in a restaurant and give you food, wait if you say the food cold, you get to watch that food day before you eat them, right? And then fruits and vegetables, make sure say you wash them before you eat them. If you decide to go with milk, you make sure say now them pasteurized dairy products and now you go with, right? Try not for eat food way na room temperature. Stay away from them food vendors then. I know sometimes we let for try everything, but trying everything sometimes can lead us to problems. I'm sure some of us don't experience, you don't eat food because you go somewhere, you buy food at the street, you eat, and then you end up with diarrhea for a couple of days, right? And sometimes too, when you travel, you primary doctor or you infectious disease doctor, you get for see, it can give you antibiotics for like 3 days, just in case you end up with diarrhea, so that you can take the antibiotics before you come. So that those are called the traveler's diarrhea prophylaxis. Try not for, stay away from raw food. Definitely have to wash everything. Also, condiments like salsa, but I don't think salsa will get that. Salad. You got to be careful which salad you eat, we out there. And some people then let for eat bush meat, then say stay away from that too. Those are things that you want to stay away from, and we go back to the hand washing is very important. Also try not for the touch your eyes, your nose, or your mouth, like especially when you don't be out there. You don't know what thing you touch, or you came in contact with, by, avoiding those things, you can really try for, prevent yourself from getting sick. Also try for, avoid close contact, like hugging and sharing utensils like spoon, then, and they share your spoon or your cup with people, especially when say they're sick. Matter of fact, no, it doesn't matter. They don't have to be sick. You don't need for the share anything that you don't know what they get, right? So you have to be very careful with those things.
So what about Imodium?
Imodium, you take down there for diarrhea.
Yes,
right?
It's fine for me to get them for go.
You can get them, but most likely the diarrhea where you get, I don't think just any diarrhea. Now something we don't eat, we get like a bacteria inside. So you need that prophylactic 3 days antibiotics for like doctor give you, which even though we discourage the use of antibiotics, but if you don't travel out of the country, you be probably not through water or food will contaminate. Now then they make you get the diarrhea. But if you feel the need, so like they run for too long, you can go with that. But at least the antibiotics along with the Imodium can help.
Okay, because this not based on me on. When I begin get the attack in a salon, I know call the medication in name. When I'm out and they advertise in a salon, they all kind of way say, "Naina the best, this and that." Because I don't get infected on Naya take and I make it not work, even though I can't get the attack back or waiting.
Maybe it was too severe. Your symptoms, depending on when your symptoms start, right? Because if you begin to get diarrhea, you get to try for eat food then.
No, this not to diarrhea. This is the malaria.
Oh, the malaria.
Yes.
So you can take anti-malaria, will you go?
No, I not take anti-malaria, but when I begin get the symptom, I say Lexina then get to one medication where they say a malaria medication at tongue day. Where I buy, I take them. I think for a couple of days it was good, then it can become worse. I began to cancel my trip and return back because it's Sierra Leone. I know so I come back anyway. So I come back and where I come, then can find out say I get malaria. So now they try for say the medication will be taken. Now because I don't get infected and I make it not work or waiting.
Yeah, most likely that's one of the reasons because when they therefore treat you, if you recall, when you come back now the States or the UK, when you come back, when they been treat you, then they treat you not just with the pill, they therefore give you other treatment modalities then, right, for put in place. Yes. And also the malaria, they go on already, like your immune system don't become weak, and you still then are the same environment, right? We don't know, maybe that environment will be the, where, it is like maybe every day there's problem. But like I said, if you don't attack your red blood cell, then it is like, then they multiply in your system. So every day then they multiply, then they feed off themselves, then they feed off your blood. So with that, now it don't chronic in your body. So they need for take, multiple steps, not just the pill that over the counter where you go to buy at the drugstore. They're not going to do that. Maybe if you didn't go to hospital, let them treat you, with the treatment that we didn't recommend, then it would have been different. No matter whether at the state or whether at the UK or whether at Sierra Leone, but they need for take care of you in a hospital. You don't need for wait until, you self-treat yourself. People that left for do treatment on their own. It doesn't work that way.
Okay, this one will be the last one. Judge Kamara say sometimes the medication be there expire. No, sir, expire, sir. I know that part they say. I know go drink if you don't expire. I buy the biggest pharmacy where they say they get a salon. So that's why I was trying to ask. But before you go, somebody they ask about the Bcg vaccine in connection with the PPD shots na the state. What you get for telling about that?
So the BCG vaccine, some people that maybe don't get the tuberculosis maclate when they're younger. So then they find out, say, there's a correlation between the two. Say, when you get that vaccine, they then give you the PPD vaccine, they become positive. So, like, then they see that as a false positive. But to correct that, since this not the skin test, you know, back not the injection, then get another test where they don't pull for many years now, maybe about 10 years almost. Is and they call that the quantiferon. This is not a blood test. So you don't even need to go back to the doctor for let them read the PPD after 48 to 72 hours. They can just say either negative or positive. So some people that will be done positive. They don't go there and do the quantiferon test where it shows it, it be negative, meaning the person not being actually be exposed, not just like that false positive skin test and end up with.
Okay. So what will be your final word for it today?
Well, they really encourage everybody where you go, let you try for check the website and go with all the recommended vaccines then where you need. Make sure say you get you anti-malaria drug, whether you left for be a bubble pain or not, or bubble TT pain, it no matter. I think it is important that you take care of yourself because when you go under, you come in contact with so many things and even the air that we breathe is different. Right? So, and ensure that the food you eat is healthy. Make sure that you clean your hands. Make sure that if you're sick, you take all the necessary precautions. But then go with Tylenol with you, Motrin, the thermometer, the hand sanitizer. Then they are all go down and even cortisone cream, like the 1%, when over the counter, you don't need prescription for that. So because if the mosquito bites you, begin to scratch them, then it open up. Before you scratch it, you put the cortisone on it. It prevents the itchiness, which now like antihistamine topical, right? So those are things that you definitely want to focus on. Check with your health doctor, and when you come back, you begin to get any of those symptoms they are. So definitely check with your doctor. Not talk and say, oh, I don't care, I 1 month this, so I don't need to, I think I'm okay. As I don't mention, it will go up to 1 year. It is still the multiply in your system, the mosquito way it don't infect you with. Okay, so that's very important. Insect repellent, you need that. If you know somebody who need to go on a beach, make sure you get sunscreen, that they can help you. And let's see, and maybe some tissues, you want to carry that with you as well. But definitely the Center for Disease Control and Prevention recommend that you up to date with all your vaccine then, and so which is very important that we do. And if you go to your Peking there, if you go with your mama, and things like that, make sure so they don't get a pneumonia vaccine, especially the elderly. Important that they get a pneumonia vaccine after certain age, and sometimes done it based on the person in health status. right? So if they get diabetes and get hypertension, or heart disease, we recommend for them get pneumonia vaccine. No matter, they don't have to be 60 or above to get the pneumonia vaccine. And the tetanus shot is very important too, because you get a bacteria component in that. So that is good for 10 years. So those are some of the things that you want to also make sure you get. Because if you go cut yourself with like a rusty iron, if you not get a tetanus shot, you put yourself at risk for, infection.
All right. Thank you very much, Aissatou. Thank you for your time.
Of course. Thank you.
All right. Well, now we go left Aissatou for today. We're not going able for answer all the questions them for this day, but hey, we don't try we level best. And for me, I'd already for that mosquito, because I don't know if are the same one now on a brother or a sister there. But the kind where I don't fortify myself, and the kind where I go fortify me surrounding, and not go for funny for me and them. So now make we come with this particular program, make we just try for advice we self and make we see how we can able for prepare ourselves before we dey go salon. We also don't learn through the comments section them on concerning the person who is saying the BCG. We also don't learn for say the chest X-ray is always recommended. Yes. We do with you, Aissatou.
Yeah, I know they talk about the BCG, the chest X-ray. Yes, they need for do the chest X-ray for make sure so you lung then clear, you don't get any respiratory illness or like they not see any tuberculosis like your lung. And sometimes people then can feel saying that the lung no more or in a respiratory no more the tuberculosis can hide. It can also hide in the bone. And we can find out about this after the person don't complain of pain at that site of the bone for so long. They end up for send a sputum, meaning like a saliva test, they find out, say, the person actually get TB, but not in lungs a day, but in bone a day. So X-ray is important for the respiratory, but maybe it hides somewhere else. It's rare, but it can happen. But the reason why I wanted to come back, the last thing, I don't know, maybe some of we've been watched the video with the health workers then. Now the glove side, whether they use gloves, whether they take care of them. That's not a very bad practice, a very bad way of handling, blood or body fluid.
On whose part? On whose part?
Huh?
On who that in part? The health workers them or the one them, because according to that video the way they talk, then they claim say they not provide gloves for them. So on whose part way now the bad practice? Well,
the health worker for know already say this not to a protocol. This not to the right way I will follow. Yes, the institution or the healthcare facility will provide them with gloves, all the necessary materials and what they need for take care of the patient. Because the goal is you want to take care of somebody, but you don't want to get sick at the same time. Because if you get sick because you will take care of someone, the next patient will therefore come. We will take care of that patient and then now you do like a cross-contamination of the disease or the virus or the bacteria we don't identify, right? So I just want, talk about the OSHA, which now Occupational Safety and Health Act of the 1917 at the United States. This act is been passed by the Richard Nixon into law. Why then pass this act? For make sure, say, the environment where this person they work is safe and it's healthful for the condition for the men and women that within the work at that environment and and also the need for ensure say that they provide training, they therefore do education constantly and make sure say the employee, for the go to the health office, for make sure that they're up to date with their vaccine, they're up to date, on their physical and things like that. And then they also provide them with like a big book where have all the different chemicals and within at the hospital. It explains to them how for use each and every one so they not become exposed. So why I feel say this important? This important because the health facility need for make the necessary things there for the staff when they work at the place. And the government for ensure say then they always do their own, they get for go there for evaluate that. For see say the place the function correctly. Like we, the hospital where they work, every 3 years, they therefore come for make sure say the hospital is up to date, right? Like then they call them joint commission. So now then you're boss dandy. Hospital then they're not afraid anything else, then they afraid the joint commission because if they come, then cite you, not fix them, then they close the hospital. So I feel say that hospital needs some help from the health, department and the salon. Somebody need to go there for ensure say the staff then get all the necessary precautions and what they need for take care of, patient. Then you talking about universal precaution, which include gown, gloves, mask, and then you will take care of all body fluids, blood and body fluids, as if they're all infectious. Whether whether this person is infected or not, you need to make sure say you take care of everything except the sweat. Right? But any other body fluid, you need to see it as an infectious agent or fluid and things like that. So I feel say the problem there in both sides. They blame the workers then because they're not ring the bell that, this is the condition we work under. While, the health department, then definitely do their own job. They need to go around and check all the hospitals and where they run at the country for make sure that they follow protocol to make sure that because when you did at school and they train you, you don't read books, you don't see how, if you put like a little saliva under a microscope, the bacteria we get for see, what do they do? So dynamic, I've been one touch on that because that was something when I watched the video, I found it very sickening at the time. And I feel saying that's something for raise an alarm for.
All right. Thank you very much, Aisatu. Thank you.
All right. Thank you.
Yeah. Judge Kamara he say in serious, he say we need for do a glove drive na salon. Talking about this glove, I get somebody now host to me, he's sick. I feel like I go na the hospital. Not to this last time. At another time where I been go salon. I feel like I go na the hospital. I have a video of waiting be happen at the hospital up till now. And long matter short, gloves not been there. So the one can get so now maybe get for tell the nurse. I say no, you need for go find gloves. You need for go find gloves. So the next day, me get gloves now. The next day, the person they go for another treatment, he go with one packet gloves. He put it inside bag. Where he reach, he say, where he reach, night tell the nurse, say, yeah, take. The nurse take, we don't take it and done. He count in gloves now. So he be they go up and down with the gloves, stay done. I even talked to somebody after I watched that video. There, I talked to a person. I say, waiting. Gloves. I say, gloves, tell me something. And I say, I'm not making this up. He says some of the patients then they buy them gloves. And you patient, you get some clinic then as salon, you patient, if you not buy gloves, if nurse one can't get you, if the nurse they use the own gloves, you get for pay for them. If they pay for that gloves the way the nurse they use for to get you. That's how bad off way they. Like for me, anytime where they go, I always get gloves there. Where even now also to me, the people that say you get for use gloves. Let alone now you step out. It's I open the phone line. We just opened the phone line for a short time. You know the discussion with Aisatu. We don't can enlighten we get for count and back, definitely. We're going to do them once every month, make we can get some health matters. But for today, we talk about the precautionary measures them where we want to go salon, what you need for know. Franklin Alfred Davis, he say gloves na salon. He say he even see gynecologist. Hey. He say he even see gynecologists where they double the usage of gloves than salon. Judge Kamara say, he say we healthcare workers them not go ever pick up another book on healthcare once they after they don't graduate in salon. They not go ever pick another book we for able for help them for continue their education. We very important as the brain now like muscle where you know use them, you dey lost them. Or you use them or you lost them. Yes, caller, you dey live on air, you name and who side you call from?
Yeah, this is Ayo, they call from US.
Yes, Ayo, you get the platform.
Yeah, first of all, I want to commend ISA 2. If my name down ISA, I'm not sure about the explanation we do. She did a very good job in explaining most of the details that concerning this traveling to Sierra Leone and Africa as a whole. But one thing we should take into consideration and remember is when we talk about salon, we know salon problem, and this they not get any serious problem about health facilities in that country there. So I start to do explain, and so people need to pay attention for them when they want to travel over the holidays for going, make sure they can get everything in place. Because if they don't, it will either cause them serious illness or it costs them a whole lot of money. If they're getting money, well, they can able for get treatment, but they therefore listen to what the woman say. You know, she made a very good point, and then follow the advice we give for those that want to travel. You know, because they're listening at salon and they go. That's my contribution. I congratulate her for what he put on the table.
Thank you very much, Ayo. Thank you, sir. Salon. Well, maybe don't pay me on price. I'm not ready for pay them again. I be don't pay me on price, so I'm not ready for pay them. Now we don't can lay in a table. The things and more we feel say we need for know before going to Sierra Leone. Even if you know they go salon, I think there are certain things that they concerning this Lassa Fever we talk about. Like I said, we send the camera there today. Now the Ministry of Health and Sanitation. The camera don't go doing work, so we just wait for make we receive, we upload and make we all see the work. Say yes, now this the Ministry of Health and Sanitation tell we, and now this we expect in the next couple of days, in the next couple of months.